Good afternoon, students. So, as we know, we have calculated we have completed the other classes. Okay. Now we will go to the dose calculation. Okay. We have told you about the other things. Now, let us see. Okay. How should we adjust the dose? Okay, for children's, for pediatric group, for geriatric group, okay, in case of renal insufficiencies, okay. So let us see. So in the objectives, after this class, everyone should be able to calculate the dose, okay, whether of any age group, okay, whether the patient is a pediatric, okay, or adult or geriatric group, okay. So can you tell till what age we consider the patients or the person of pediatric or children's till 18, okay, and what about geriatric? Geriatric means, have you heard the term geriatric? What is that? Older or adults, okay. Those comes from the age above 60, okay. Those group of patients or person are known as geriatric group of patients, okay. So then in case of renal diseases, okay, then we'll come to loading and maintenance dose. Then what are the dilutions and strengths, okay, we'll also talk about them. So in our previous classes also we have discussed that what is dose, okay. So it is the appropriate amount of drug which is required to produce a certain degree of response in a patient at a given time, or it can be repeated in an appropriate interval to produce the desired therapeutic effect, okay. Some examples, like for diagnosing certain diseases, okay, we used iodine based dye or contrast based dye, okay. Have you heard the term Barrett esophagus? Have you heard? What is that? So in case of GERD, okay, gastroesophageal reflux disease, okay, in case of that, what happens? The lining changes, okay, the esophageal lining changes. There is dysplasia, okay, of the lining, okay. There, what happens? You will change the lining, the structure. There is a structural change in the esophagus, okay. Sometimes it might lead to malignancies also, certain malignancies, okay, like CA or carcinoma of the esophagus. So it is a benign condition, okay. In those cases, we also use iodine or contrast based dye, okay, in case of X-rays, and in cases of certain CT scans also, we give certain dyes, okay, to visualize the internal organs, okay. Then for prevention, like in case of tetanus infection, we give the vaccine. We all know tetanus vaccine, okay. Then for treatment of fever and pain, we give paracetamol, okay. So all are based and calculated on the basis of dose, okay. So now today we will see how to do it, okay. So what is the importance of this dose? If you know what is the benefit, certain scenarios or situations, like if you are posted in an emergency, okay, if a patient of acute exacerbation of bronchial asthma, COPD, okay, or a patient of migraine infarction, ischemia, or a stroke patient comes, or certain poisoning patient comes, okay. So that patient will give you very less time to act, okay. So if you know the dosage and the calculation properly, you can act much faster, okay, to stabilize the patient, okay. So that is one benefit, okay. Other than that, in extreme ages, like pediatric patients, okay, then geriatric patients, in case of pregnancies, okay, in case of hepatic and renal dysfunction, there is the importance, okay. So loading dose is the initial, okay, initial volume of drug which is given to a patient, okay. So it is the therapeutic plasma concentration multiplied by volume of distribution, okay. You understand the therapeutic plasma concentration, okay. Therapeutic plasma concentration means when you give the drug, it is a certain degree or level into the plasma at which the drug is effective, okay, to produce a therapeutic response. Suppose you are giving a drug for bronchial asthma, okay, a bronchodilator drug is being given, okay. When it reaches certain level in the plasma, at a certain concentration, then it acts properly, okay. That is known as the therapeutic concentration, okay. And what about volume of distribution? Volume of distribution means it is the total concentration of the drug in the body by the total concentration of drug in the plasma or in the blood. Okay? Understood? So this is the loading dose. And what is maintenance dose? In our classification of different forms of drug, in the oral route, we have discussed with you about some tablets, right? Like the delayed releasing tablets. The delayed releasing tablets, how they act. Okay, I told you they have two coatings. The primary one, it releases fast. It releases a certain level in the plasma, and a concentration is being produced. Okay, and now when it reaches that concentration, after that the next level or the next drug is being released, and then it is released slowly, and then the concentration is maintained. So here the difference is that after initial dose we again have to give a maintenance dose. Okay, it is not a single drug, we have to give it per day according to a day. Okay, so here the maintenance dose is a steady state, okay, which is maintained after giving a loading dose, and the amount of drug is excreted is replenished daily, and that is known as maintenance dose, and this depends on the clearance of the drug. Okay, and the same amount of drug which we have given to a patient, it is attained in the plasma, and the same amount of drug it should be excreted through the either urine or in the form of stool. Okay, so the clearance should be maintained. So maintenance dose is the therapeutic plasma concentration multiplied by clearance. Okay, this is the maintenance dose. So the volume of distribution, as I said, okay, it is the ratio between the amount of drug in the body and the concentration of drug which is maintained in the blood, okay, or in the plasma. And what is therapeutic plasma concentration? When the rate of absorption is equal to the rate of elimination. Okay. So to reach this state, this drug has to be completed 4 to 5 half-lives. Okay. What is a half-life? Can you tell me? Yes. So suppose I am giving a drug, suppose a PPI, okay, a proton pump inhibitor. There are various proton pump inhibitors, and they have different half-life. Okay. Like in case of omeprazole, okay, it is around 24 hours. Okay, and in case of pantoprazole, you can give it for 2 times. Okay, or 12 hours you can give. Okay, it is a short half-life. Okay, so now comes what is plasma half-life. Okay, so it is the time taken for the plasma. For the plasma concentration, we reduce to half of its original value. Okay. Okay. So it is determined the volume of distribution and clearance. Okay. So T half, how do you find T half? It is 0.693 by Kelvin, that is elimination constant, and clearance means elimination constant into volume of distribution. Okay. Now about drugs dilution and its strength. Okay. So we know that solids group of drug are expressed in milligram, and in liquid it is expressed in milliliters, and in case of biological preparation we express it in international unit, okay, percentage, sometimes or in proportions. Okay. Strength expressed as percentage. Okay. So let us see if if a liquid dose, for solids in liquid, okay, if we say that 1% of the solution is given, what does it mean? Okay, it means 1 gram of solute is dissolved in 100 ml of solvent. Okay, this is in case of solution. And what in case of solids, it means that number of grams of active constituent in 100 gram of formulation. Okay, understood? And for liquid in liquid, the volume of active constituent in 100 ml of total formulation. Okay, that is expressed in volume by volume, that is V by V. Okay. So here some ratios been given. So try to understand. Strength expressed as proportions, like 1:1000. What does it mean? It means 1 gram, that is 1000 milligram of solute in 1000 ml of solvent. Okay. So here, so if it is expressed in ratio like 1:100, so what is the concentration here? It is 10 milligram per ml. Understood this one? So today's class will be on calculation. Okay, to try to focus. You have to do some problems. I'll be giving it to you. Okay, so understand the basics first. Okay, yes, otherwise you won't be able to perform. Okay, so here how it is 10 milligram per ml. Understood? This means what? 1:100. What does this mean? 1 gram of solute is dissolved in 100 ml of solvent, isn't it? So if I divide this by 100, how much it is? 10, isn't it? Same way, if I take this ratio like 1:1000, it will come around 1 milligram per ml. Okay. Next is 1:10,000, it comes to 0.1 milligram per ml. Okay. So same way for 1:1 ratio, it comes from 10:900. Okay. So 1 milligram is equal to 1000 microgram. Okay. So let us give you a problem. Let us see how you are getting the class. Okay. What amount of drug solution you will administer from a 5 ml of vial containing what amount of drug solution you will administer from a 5 ml of vial containing 10 milligram of drug if the required dose is 2 milligram. Repeat. Okay. So what amount of drug solution you will administer from a 5 ml of vial containing 10 milligram of drug if the required dose is 2 milligram. So how much volume or ml of drug you will administer? 1 ml, first bench. So 5 ml of this vial contains 10 milligram. 1 ml contains 2 milligram. So hence 1 ml should be administered if 2 milligram of the drug has to be administered. Okay. Any confusion? So now we'll go to the calculation main part. Okay. So how will you calculate the dose? Okay, according to weight, on the basis of weight. Okay, if you want to calculate the dose of the, this is for pediatric. Okay, if you want to calculate the dose, so the adult dose multiplied by weight in kg by 70. Okay, on the basis of weight, and 70 I am considering why? Because this is the average weight, okay, of a healthy individual. Okay. So this is the formula. So this weight is for above 55 kg. Okay. So this is on the basis of body surface area. Okay. We can calculate the dose either through weight or through body surface area. Okay. Body surface area is more appropriate, but it is difficult to calculate. Okay, so we go to the weight part. Okay, most of the time because it is much more easier. Okay, so on the basis of body surface area, the dose equals to adult dose multiplied by body surface area, which is expressed in meter square by 1.73. Okay. Now this body surface area, if you are not getting the body surface area, if it is not given, how will you find out? Okay. Again, there are two formulas. One is Monstala's formula and one is Dubois formula. Okay. So here the body surface area equals to square root of height in centimeters multiplied by weight in kg by 60. Okay. In case of Dubois formula, the body surface area equals to weight in kg at the power 0.0425 into height in centimeters, the power 0.75 multiplied by 0.00718. Okay. So according to age, if you divide the calculation up to 2 years of age by Price rule, okay, the dose is equals to adult dose multiplied by 18 months by 150. On the basis of weight, the same one, and if the age of the child is more than 2 years, then Young's formula or by Haley's formula. Okay, here the dose is equals to adult dose multiplied by age in years plus 12. In case of Haley's formula, adult dose multiplied by age in years by 20. So here we are having according to age. Okay. The calculation. This is for pediatric anatomy till there was some weight. You haven't written till 55. Till 55. Okay. For elderly patients more than 60 years. Okay. So there is no fixed formula or rules for this age of group. We just simply reduce the adult dose to 2/3 of the dose. Okay. Because why do we do that? Because according to the age, the functioning of the liver, the kidneys, okay, all they deteriorate. Okay, functioning is gets less, and then there is wastage of the muscle glucose. Okay, for this reason, they will have less weight also. So we just reduce the dose to 2/3. Okay. So in case of renal failure or renal dysfunction, so in those patients also, if suppose if you are giving a certain group of drug and if it is not eliminated from the kidneys, okay, what do you think? What will happen? If the patient is having renal dysfunction, toxicity, okay, and it will start damaging the other organs, isn't it? So that is why we reduce the dose of the drug in a renal failure or renal dysfunction. Okay. So calculation of dose of this patient is based on creatinine clearance. Have you heard the term creatinine? What is that? Produced by muscle. So there is a pathway, creatine pathway. Okay, from there the creatine comes. Okay, when the muscle breakdowns. Okay, so here with this creatine clearance, also we can calculate. Okay, so suppose if a patient is renal insufficiency and you have to give a certain amount of dose to a patient, so how will you calculate? Okay, so here the dose will be adult dose multiplied by creatinine clearance in renal insufficiency for that patient and divided by creatinine clearance in normal individual. So you have to divide it by the creatinine clearance of the normal individual. Suppose if this creatinine clearance is not known to you, there is one more formula. Okay, with that we will calculate. This formula is known as Okrop-Golf formula. This is used to calculate the creatinine clearance. Okay, this expressed in ml per minute. Okay, for male it is 140 minus h in years multiplied by weight in kg divided by 72 into serum creatinine in milligram per deciliter. Okay, so for male this is the formula, and when the results comes, we have to just multiply by 0.85 if the patient is female. Okay, so the creatinine clearance in a normal individual weighing 70 kg, for body surface area it is 1.73 meter square. It is equal to 100 to 1.10 per minute. So this is the normal creatinine clearance, okay, of a healthy individual weighing 70 kg. So this elimination, as I said, is to be eliminated through UV, through stool, through air. Okay, through air how? Pulmonary system. Okay, when we breathe out. Okay, and also from skin also. Okay, through sweat. Okay, so this, if the patient is having other dysfunction like hepatic dysfunction, okay, so this total clearance will be creatinine clearance of renal plus hepatic clearance and other if it is heavy. Okay, so this will be the total, and it will be expressed in ml per minute. Okay. So clearance of a drug is the theoretical volume of any body fluid from which the drug is completely removed in time. Okay, so it is a completely clearance of the drug. Okay, in the body fluid. Okay. So now comes the problems. Okay, so you have written all the formulas. Okay, so let us see your maths. So what is the first question? What is the first question? Calculate the dose for a 35 kg pediatric patient if adult dose for a 70 kg patient is 500 milligram. How will you calculate? What is the formula? What is the answer? 250. Others? Part 250. Number one. Okay, easy. So let us go to the next problem. Okay, what amount of drug solution will you administer from a 10 ml of vial containing solution of the strength of 2% of drug if the required dose is 20 milligram. In 100 ml it is 10 milligram. It is 1%. Okay. So for 2% it will be how much? 20 milligram, isn't it? 20 milligram per ml. So you have not written this one. I have not understood this one. Okay. So 2% means how much? 20 milligram. If 1% means here it is 10 milligram per ml. How it can be understood here? So here 2% means what? 2:100, isn't it? So it is 2000 milligram in 100 ml of solvent. So now if you divide it, it comes around 20 milligram per ml. Understood? So now how will you do the problem? So what the problem is saying, what amount of drug solution will you administer from 10 ml of vial containing the solution of strength 2% of drug if the required dose is 20 milligram? Is it 20 milligram per ml, isn't it? So in each ml there will be 20 milligram of the drug. Okay. Any confusion? Last bench. Understood? You are not getting, madam? Not getting why? Here what is saying? What does 1% mean? I already said na. It is 1 gram. That is 1000 milligram of the solute is present in 100 ml of solvent. If you divide it, what comes? 10 milligram. Easy. Now what does 2% mean? Simply 2000 milligram is dissolved in 100 ml of solvent. So if you again divide it, it comes 2%. Understood? 20 milligram per ml. 20 milligram per ml means what? In each ml it is containing 20 milligram of that. Isn't it? Oh, sorry. Here it is 100, isn't it? I am speaking about 100. So if it is 1:, this one, 1000. It is 1000. In 100 ml it is, if you divide it by 100, it comes 10, isn't it? You? Okay. Last bench. So here it is saying that if it is 1:100, that means 1000 milligram of the solute is dissolved in 100 ml. And if it is 1:10,000 or 1000, it is 1000 of solvent. Solute is dissolved in 1000 ml of solvent, isn't it? So if you divide it, it comes 1 milligram per ml. Any problem, madam? It is complete, or you have something doubt? Okay. Let us move on. Okay. So here how much we have to give? It is 1 ml, isn't it? So what is the third problem? What is the strength of 0.1% solution in milligram per ml? You can solve this. What is the solution here? Understood any confusion here? This was easy. Can I move to the next slide? Okay. So the next problem is, if 1 ml of 1:2000 solution is diluted up to 5 ml, what will be the strength of the resultant solution? What will be the strength? Can you tell? 1 mg. How? What does 1:2000 mean? Huh? How? Are you sure? It is 1 mg per 2 ml. It is 1 mg per 2 ml, isn't it? if you divide 1000 by 2000, how much it comes? It comes how much? It comes 1 mg in 200 ml or 0.5 milligram per ml. Confusion? Simply divide it. Simply divide it. It will give you the answer. Divide 1000 by 2000. How much it comes? 1:2000 means what? First step. It is how much? 1000 milligram of solid is dissolved in 2000 ml of solvent. Okay, that will be in milliliter ml. That is expressed in milligram and that is expressed in milliliter. So if you divide it, simply it comes. If you just cut the zeros, it will come 1 milligram per 2 ml. So if you further divide it, how much it comes? 0.5 milligram per ml, isn't it? So 0.5 milligram per ml of that solute or the solvent I have dissolved in 5 ml, isn't it? So simply by unitary method, if you do, 5 ml contains 0.5 milligram of the drug. Now 1 ml will contain how much? 0.5 divided by 5, isn't it? Yes, 0.1 milligram per ml. This is by simple unitary method if you do it. Any confusion? Anyone who has not done last bench? I am not getting any response. And whether you are getting, not getting. So what it says is, this 1 ml of solution, it is containing how much? 1:2000 ratio of solution it is containing. 1:2000 means what? 1000 of the solute is dissolved in 2000 ml of the solvent. So if you simply divide it, okay, if you just cut the zeros, okay, how much it comes? 1 milligram per 2 ml, isn't it? So further if you divide it, it comes 0.5 milligram per ml. Now this 0.5 per ml, if you calculate in association with the 5 ml, so 5 ml will contain 0.5 solution. So each ml how much will contain? 0.5 divided by 5. So if you cut and divide it, how much it comes? 0.1 milligram per ml. Okay. And further, if you express in strength, like in ratios, how will you write in strength in the form of ratio? 0.5 milligram. How? Huh? 0.5 is not 0.1 is the answer, isn't it? I am saying if you express this in strength, like in ratio, how will you express? One is to 10,000. Understood? Any confusion till here? Okay, so let us move to the fifth problem. So, calculate the corrected dose in a patient with creatinine clearance of 50 milligram per ml per minute if the drug is cleared 70% by the kidney, 30% by the liver, and normal therapeutic dose is 100 milligram per day. So here a formula is there, okay, that is known as dose adjustment factor. Okay, dose adjustment factor. So dose adjustment factors equal to non-renal elimination multiplied by, write it down, dose adjustment factor is equals to non-renal elimination plus in bracket 1 minus non-renal elimination bracket close multiplied by ratio. Okay. So here so if it is in percentage, you have to express in values. Okay, you cannot put directly on the percentage here. Okay, so here we will convert the percentage in values. Okay, so if I convert the renal clearance like 70% in values, how will you write? It is 0.70. isn't it? And in case of hepatic, 0.30. Easy. Okay. So for the ratio, there is another formula. Okay. So the formula for ratio is creatinine clearance of the patient by normal creatinine clearance. So what is the creatinine clearance of the patient? 50 ml per minute. What about the normal patient? 100 to 120. So for the normal patient, the creatinine is 100 to 120. I have already given the normal values. Okay, in the previous slide. So if we take 100 as the normal value, now what will be the ratio? 0.6. It is 50 now. 0.5. Okay. So 0.5. Okay. So this is the ratio. So now you have got the ratio. You have got the non-renal elimination. Which one is the non-renal elimination here? Liver. So calculate. How much is the answer? You have not written. Why? Formula you have not written. So dose adjustment factor is non-renal elimination plus in bracket 1 minus non-renal elimination bracket close multiplied by ratio. You can use calculator also. Everyone got 0.65? Any other value got? What? Answer? Non-renal elimination plus in bracket 1 minus non-renal elimination bracket close multiplied by ratio. This is not the ratio. I told you, na? You have to express in values. What is the formula for the ratio? You have not written? The formula for ratio is creatinine clearance of the patient divided by normal creatinine clearance. So what is the clearance of the patient? 50. And what is the normal clearance? 100 to 120. You can take 100. If you take 100, then how much? How much? 50 divided by 100. How much? 1 by 2. 0.5, isn't it? So this is the ratio. So now put that ratio in the formula and tell me the value. Where you are having confusion, tell me. There is a formula. If you want to calculate the corrected dose, you need to have the dose adjustment factor. What is the factor? 0.5. How? Non-elimination is 30%. Okay. So I have told you have to express in values, not in percentage. If it is 30%, then how much is the value? It is 0.30 if you express from percentage to value. If you directly take the percentage, okay? Don't confuse it. Okay? If it is renal, if it is 70%, then what is the value? 0.70. For hepatic it is 0.30. There shouldn't be any confusion here. No. Here already the value has been given. This 50% is being calculated and then given to you. It is not that you have to calculate it further. The value has been given to you clearly. Hmm? 0.5. Okay. So now put that ratio in the formula and see. And what is the result? You can tell me if you are having any doubt. Just put the values in the formula. It is as easy as that. I am making it very easy for you. Okay. 0.5 is the ratio. First is the non-renal elimination. What is the non-renal elimination? It is 0.3. Then plus 1 minus 0.330, then multiplied by 0.5. Then if you remove the bracket, what comes? On removal of the bracket, what comes? Answer is 0.65. Okay. So next is the, so here they are saying to write the corrected dose. Okay. So what is the, how we will calculate the corrected dose? It is the normal dose. Okay. This therapeutic dose multiplied by the value which you got. Okay. That is the dose adjustment factor. Do it. Corrected dose is the normal dose multiplied by the dose adjustment factor. Okay. Now tell me how much? 65. What is the unit? Huh? Milligram per day. Okay. Problem number 6. It is saying what is the loading dose to achieve plasma concentration of 3 milligram per liter, where the volume of distribution 4.7 liters per hour and clearance is 20 liters. How will you calculate loading dose? What is the formula for loading dose? Therapeutic plasma concentration multiplied by volume of distribution. Okay. So plasma concentration by volume of distribution. So what is the answer? Simple. Very simple. Hmm? 14.1 milligram. Okay. Understood? Any confusion here? Milligram. ये जो आवर है इसमें लीटर है. This only the distribution is only in liters, not per hour. Okay. Now calculate. ऊपर नीचे हो जाएगा. ठीक है. This will come in expressed in milligram. Okay. Let us move to the next one. So the creatinine clearance of a patient with renal failure is 25 ml per minute. How would you adjust the normal dosage of gentamicin for this patient, where the gentamicin dose is given 80 milligram 3 times a day? How will you calculate? Okay. So calculate. The result will come 60 milligram per day. Okay. And if you further divide according to this, it will be, if it is given 3 times, it will be 20 milligram. Okay. Each dose. Okay. If it takes 3 times a day, isn't it? Any confusion? Now next exercise. Calculate the dose of paracetamol in a 6-year-old child while adult dose is 500 milligram at the time of fever. What is the formula for this 6-year-old child? There are 2 formulas. Okay. So calculate. The values has been given clearly. 166. Okay. So what will be the value? What will be the value here? Unit will be in the mg, isn't it? So you have calculated through Young's formula. What about the Delling's formula? If you calculate 166 through Young's formula. If you calculate for Delling's, what will be the result? Okay. So let us move to the next problem. Calculate the dose of ibuprofen in a child of 12 kg, while adult dose is 400 milligram 3 times a day in musculoskeletal pain. How will you calculate? What is the formula for calculation of the dose? This is a child, okay? This is a child. The weight has been given. So how will you calculate? What is the formula? Simple formula. Answer. Yes, 68.5 milligram. Okay, 3 times a day. Okay. Any confusion here? No confusion. Okay. Let us move to the next. Last bench. You have solved it. So calculate the dose of an anti-cancer agent A in a child having body surface area of 0.78 square meter, while adult dose is 20 milligram per day. Huh? What is the formula for the body surface area? 9. What is the unit? 9 milligram per day. Okay. Last bench. Yes, sir. Okay. So let us move to the next one. Calculate the dose of amikacin in a 39-year-old female, weight 52 kg, having impaired renal functions, and serum creatinine is 1.8 milligram per dl, while the normal dose of the creatinine is 15 milligram per kg per day. How will you calculate the dose? Huh? Okay, so how will you calculate and what is the answer? Here we will use, I have told you now, for the creatinine clearance we have to use which formula? Cockcroft-Gault formula. Okay. So just put the values there directly and you will get the answer. 4.4 ml. Okay. So here one thing, see, during the calculation, okay, it was told for males. Okay. Here it is female. So for female, what you have to do? Uh-huh. 5.16. No. Okay. So with this formula, what is the value? It is 34.4, isn't it? 30.4 ml per minute. Okay. Everyone got this? Bench. So now what is the dose? So that was the, then we need the dose here. So what is the formula for dose? By normal patient creatinine clearance. So what is the value? Huh? Unit mg per day. Okay. Others got the same or different value? Any confusions? Could you solve the first one, the first part of the problem? Creatinine clearance. Okay. What is the value got? 34.4 around. Okay. This is the unit is ml per minute. Okay. Now then we calculate the dose. What is the formula for the dose? Adult dose multiplied by. Okay. Then divided by normal dose. Okay. Normal creatinine clearance. So what is the result? Huh? 201. How? Adult dose is how much? 15 mg per kg per day. So this is just a dose, but the person for whom you are calculating the dose, he has a weight. So what is the normal healthy person weight? What I told, that is 70, isn't it? So if you calculate for 70, it comes around how much? 780, isn't it? For normal healthy individual, okay, if you calculate it, you have to multiply with 70, so it comes around 780. So now this is the adult dose. Okay, total adult dose. Now calculate. What is the result? 5.46. How, sir? Adult dose is how much? How much? This is the value, 15 milligram per kg per day, per milligram. For 1 kg it is 15. For the normal patient, healthy patient, what is the weight? 70. So you have to multiply it. That is the adult dose. So here the weight has been given. Okay. Okay. So you have to multiply by 52. Okay. So what is the answer? So here the weight has been already given. Okay. It is 52. So you have to multiply this 15 with 52. Now the weight is how much? Yes. No. How divided by 70? It is divided by, okay, normal. Normal creatinine is around how much? It will be in the creatinine clearance formula. Okay. Not that you are taking the formula for the pediatric dose which we have discussed. Not the pediatric one. The one is for the creatinine. Another formula is there. Because here it is clearly mentioned renal impairment. एक दूसरा फॉर्मूला है रेनल इम्पेयरमेंट का, मैंने बताया था कि डोज इज इक्वल्स टू एडल्ट डोज मल्टीप्लाइड बाय क्रिएटिनिन क्लियरेंस. इट इज इम्पेयर्ड और रेनल इनसफिशिएंसी बाय नॉर्मल क्रिएटिनिन क्लियरेंस. दैट इज द फॉर्मूला. Because here the problem is directly written, impaired renal function. Okay. So what is the result? 106 how? 206. What is the adult dose? No. Here the weight has been given. 780. Yes. It is. You have to multiply by 52. 780. Now, what is the impaired? It is 30.14 divided by 100. Now, what is the result? 268. What is the unit? mg per day. Okay. Just put the values in the formula and get the result. Okay. Let us move to the next problem. Calculate the dose of azithromycin in milligram for tonsillitis for a 6-year-old girl weighing 21 kg provided the dose requirement is 12 milligram per kg per day for 5 days. How will you calculate the dose for this child? What is the formula? Simple formula. What is the formula? More than, it is 6 years, so more than 2 years. But here the weight has been given. So how will you calculate? Dose is equals to adult dose multiplied by weight by 70. Okay, so this is the formula. How will you find the adult dose here? This is the dose of the child. What is the adult dose? You are putting in the formula, isn't it? What is the adult dose here? How much? 840. Here this is the calculation for the child. Okay, in previous one the weight was given, isn't it? So here the adult dose is not given. You have to calculate it. How? You have to take the normal value, normal healthy individual weight. What is that? Individual's normal 70. Multiply it. Multiply by 12. किससे multiply करेगा? It is written 12 milligram per kg per day. Till 55. Till 55 this formula is you can calculate. ठीक है? 21 आएगा. तो इसमें देखो, इसमें तो तुम्हारे weight दे दिया है child के लिए. The weight has been already given. For this adult dose calculation, you are using that weight. Not this one. Adult dose. Without putting the adult dose, how will you calculate? For that adult dose calculation, we have to take the normal healthy individual weight. What is that? 70. The dose has been given. For azithromycin, it is 12 milligram per kg. So simply multiply it, you will get the adult dose. Now put it on the formula. What is the formula? Dose equals to adult dose multiplied by body weight by 70. It is 252 milligram per day. Any confusion? Formula क्या था? Adult dose multiplied by weight, total weight of the child. Weight कितना है इसमें? 21 kg. 840 into 21 multiplied by 70. कितना आ रहा है? This is, you can calculate till 55 years. Okay, if the weight has been given. Okay, any confusion? I can move. So the next one is, what will be the dose of the anti-cancer drug X for a child Sumit having BSA body surface area is 0.78 meter square. The adult dose is 10 milligram per day. You have to just put in the formula, nothing else. No need to do anything, any modification. Just put the values in the formula, you will get the answer. Which one? Okay, 185.18. Not per day, it is milligram. Okay, not per day. Others solve the rest. Next one solve. 185 milligram. Okay. Master Anand Sharma, a 6-year-old boy, weight 28 kg, having URTI. How will you calculate the dose of azithromycin and calculate the dose? Adult dose is 500 milligram. Simple. 200 mg. Okay. This is the dose. Okay. Per dose. Any confusion? Finish. Last bench. कौन सा क्वेश्चन अटका हुआ है तू? Where you are stuck? Last one. The upper one you got the answer. Second one you are doing complete. What is the answer? 4.5. What is the unit? mg per day. Okay. The next one. So in your exams, okay, this dose calculation you have to do it by your own. Okay, that is why you are making your practice. Okay, others will be coming like infusion, injectables. Okay, how will you administer? How will you give the drips? Okay, loading dose, maintenance dose. Okay, this is just for a practice. Okay, to make you more comfortable with these problems. Okay.